its toxicity.
What's the biggest challenge cancer researchers face? Steve?
Well, it's at several levels. First, the challenge of understanding the cancer cell has really been the life's work for Steve Rose and myself and many people across the United States, because I think that's what has revealed the clues that we use to develop very targeted therapies or immune-based therapies. Last year, on the cover of one of the prestigious science magazines was that immunotherapy now is the fourth partner in the way we treat and cure cancer. Besides surgery, radiation, chemotherapy, there's now immune-based therapy, using a person's own immune system to help in that fight. And I think all that's been derived from basic research. I often will tell patients that there's no therapy that we're using on them that wasn't derived from somebody's idea in some laboratory working late into the night. And so the other challenge, I think, is maintaining a certain level of funding so that all ideas that are good get a chance to see that they're going to help someone.
So part of the challenge is finding funding for somebody who's working late into the night to develop either treatment or a cure.
That's correct. I think because Steve and I have been doing this for a long enough time, I think we're all very, sometimes painfully aware of what we can do now. Had we known it then, we would be with us today. So there's a certain tyranny of time that comes with our work and why we want to move faster. And I think, as Robert was saying, I think one of the things we pride ourselves on at City of Hope is try and take that idea, like, is in a laboratory, and move it as quickly as we can to the bedside. And I think people come to us, and other cancer hospitals are the same way, for that purpose.
How long does that process go?
Well, from an idea to a drug, historically has been sometimes 7 to 10 years. And I think what we try to do is shorten that as quickly as we can on some of these biological therapies by, grants, partnering with pharmaceuticals, other cancer centers, and because the patient is sitting there looking at you in the room that day. And I think that's part of the personal, people talk about personalized medicine. There is the idea that we want to give you the right therapy for the right gene and the right cancer that you might have, but not at the expense of depersonalizing the experience. I think for all of us who take care of people with cancer, it's a person-to-person relationship, and we are grateful for the trust they place in us to take care of them or their family member, because it's very much more than a one-person experience.
What are the big questions we don't know?
There's an enormous amount we still don't know. Having said that, in the last 10 years, we've started to understand the genetic composition of cancers, the genes that are...
City Clerk, please call the roll.